Acupuncture, one or more needles, without electrical stimulation, initial 15 minutes of personal one-on-one contact with the patient. Each additional 15 minutes. Acupuncture, one or more needles, with electrical stimulation, initial 15 minutes of personal one-on-one contact with the patient. Each additional 15 minutes. The healthcare provider applies acupuncture therapy by inserting one or more fine needles into the patient as dictated by acupuncture meridians for the relief of pain. The needles are twirled or manipulated by hand to generate therapeutic stimulation. No electrical stimulation is employed with this procedure. For electrical stimulation, the needles are energized by employing a microcurrent. Medical nutrition therapy. Medical nutrition therapy, initial assessment and intervention, individual, face-to-face with the patient, each 15 minutes. Reassessment and intervention, individual, face-to-face with the patient, each 15 minutes. Group, 2 or more individual, each 30 minutes. A dietetic professional provides medical nutrition therapy assessment or reassessment and intervention in a face-to-face or group patient setting. After nutritional screening identifies patients at risk, preventive or therapeutic dietary therapy is initiated to induce a positive result in the role nutrition plays in improving health outcomes. Osteopathic manipulative treatment, OMT, 1 to 2 body regions involved. 3 to 4 body regions involved. 5 to 6 body regions involved. 7 to 8 body regions involved. 9 to 10 body regions involved. The physician uses these codes to report osteopathic manipulation, unique manual treatments that are used to treat somatic dysfunction and related disorders. Several techniques exist. Body regions included are head, cervical, thoracic, lumbar, sacral, pelvic, extremities, rib cage, abdomen, and viscera. Chiropractic manipulative treatment, CMT, spinal, 1 to 2 regions. Spinal, 3 to 4 regions. Spinal, 5 regions. Extraspinal, 1 or more regions. The chiropractor uses these codes to report the unique manual treatments used to influence joint and neurophysiological function. Several modalities exist. Education and training for patient self-management by a qualified, non-physician healthcare professional using a standardized curriculum, face-to-face with the patient, could include caregiver/family, each 30 minutes, individual patient. 2 to 4 patients. 5 to 8 patients. The qualified, non-physician healthcare professional provides education and training using a standard curriculum. This training is prescribed by a physician to enable the patient to concurrently self-manage established illnesses or diseases with healthcare providers. Telephone assessment and management service provided by a qualified non-physician healthcare professional to an established patient, parent, or guardian not originating from a related assessment and management service provided within the previous 7 days nor leading to an assessment and management service or procedure within the next 24 hours or soonest available appointment, 5 to 10 minutes of medical discussion. 11 to 20 minutes of medical discussion. 21 to 30 minutes of medical discussion. A qualified healthcare professional, non-physician, provides telephone assessment and management services to a patient in a non-face-to-face encounter. These episodes of care may be initiated by an established patient or by the patient's guardian. These codes are not reported if the telephone service results in a decision to see the patient within 24 hours or at the next available urgent visit appointment. Instead, the phone encounter is regarded as part of the pre-service work of the subsequent face-to-face encounter. These codes are also not reported if the telephone call is in reference to a service performed and reported by the qualified healthcare professional that occurred within the past 7 days or within the postoperative period of a previously completed procedure. This applies both to unsolicited patient follow-up or that requested by the healthcare professional. Qualified non-physician healthcare professional online digital assessment and management, for an established patient, for up to 7 days, cumulative time during the 7 days, 5 to 10 minutes, 11 to 20 minutes, 21 or more minutes. Online digital evaluation and management services are non-face-to-face encounters originating from the established patient to a qualified non-physician healthcare professional for evaluation or management of a problem utilizing Internet resources. The service includes all communication, prescription, and laboratory orders with permanent storage in the patient's medical record. The service may include more than one provider responding to the same patient and is only reportable once during 7 days for the same encounter. Handling and/or conveyance of specimen for transfer, from the office to a laboratory. From the patient in other than an office to a laboratory, distance may be indicated. Handling, conveyance, and/or any other service in connection with the implementation of an order involving devices, e.g., designing, fitting, packaging, handling, delivery or mailing, when devices such as orthotics, protectives, prosthetics are fabricated by an outside laboratory or shop but which items have been designed, and are to be fitted and adjusted by the attending physician or other qualified healthcare professional. Postoperative follow-up visit, normally included in the surgical package, to indicate that an evaluation and management service was performed during a postoperative period for a reason, related to the original procedure. Hospital mandated on-call service, in hospital, each hour. Out of hospital, each hour. These codes report the time for hospital mandated on-call service provided by the physician and do not include prolonged physician attendance time for standby services or the time spent performing other reportable procedures or services. Service, provided in the office during regularly scheduled evening, weekend, or holiday office hours, in addition to basic service. Services provided in the office at times other than regularly scheduled office hours, or days when the office is normally closed, e.g., holidays, Saturday or Sunday, in addition to basic service. Service, provided between 10 p.m. and 8 a.m. at 24-hour facility, in addition to basic service. Service, typically provided in the office, provided out of the office at request of patient, in addition to basic service. Service, provided on an emergency basis in the office, which disrupts other scheduled office services, in addition to basic service. Service, provided on an emergency basis, out of the office, which disrupts other scheduled office services, in addition to basic service.